on Broadway.
Control officer come by. Had to be moved by 11.
Megan's holding the door open.
Give a ticket.
I'm like, what the heck are you doing? She goes, I work here.
I know people.
Time I was getting in my car, get ready.
That's cool.
Okay, let's get started here. Notice of an open work session of the City Council of the City of North Kansas City, Missouri, October 2nd, 2018. Eric?
Thanks, sir. Tonight's work session is about medical marijuana. The state of Missouri has 3 separate initiatives on the ballot in November to legalize medical marijuana for qualifying patients. That's up for a public vote on November 6th. So we thought it would be a good idea to just provide some information to you about medical marijuana generally, the ballot issues in particular, what some of the implications might be if one or more of these initiatives pass, and maybe try to get your general feelings about some of the things that we'll inform you about tonight, just to provide us perhaps some guidance for the future. If one or more of the initiatives does pass and does become law, our intention would be to then develop some draft regulations for your consideration over the next several months after the election. And so this is really the beginning of an information process as far as we're concerned. The person that did all the research on this was our administrative intern last summer, Megan Summers, who did not have the opportunity to make a presentation to you during the summer, so we asked her if she could come back tonight, and she was able to do that. So we're pleased to have her here, and at this point, I will turn the presentation over to Megan.
Great. Hi, Mayor and Council. How you guys doing?
Good.
Good. So since there are 3 pieces of very different legislation that's on the ballot, it's next month. We want to kind of let you know what's on the ballot. We're going to look at what is medical marijuana. So we thought we would want to look at if medical marijuana does become legalized, what sort of security provisions are included in each piece of the legislation, and then how is crime going to be affected if medical marijuana legislation is legalized? What does that mean for the cities where dispensaries and other facilities are located? We will look at what is the city's role and city council's role going to be if medical marijuana is passed, and then what are those specific decisions that are going to need to be made. So the most common use for medical marijuana in the United States is pain control, especially for chronic pain that's related to multiple sclerosis or nerve pain. It can be used as a muscle relaxant. It will lessen the effects of conditions like Parkinson's disease, fibromyalgia, and endometriosis. It can also mitigate nausea, minimize the onset of glaucoma. It helps with wasting that's associated with HIV, and it helps with the effects that come from IBS and Crohn's disease. It can be consumed by vaporizing or smoking the dried flowers. You can ingest capsules or teas. There's ointments or balms that have been made available. There's transdermal patches or suppositories that can be used. Or you can consume cannabis-infused food products. So here we have some visual aids. You see, we see some dried flowers, the transdermal patches. There's infused chocolate, capsules, and then sublingual tinctures that can be used. So each initiative that is on the ballot in November, in order to be eligible to receive a prescription for medical marijuana, you have to be deemed to have a qualifying medical condition. That includes cancer, epilepsy, glaucoma or migraines, ranging to muscle spasms, psychiatric disorders, HIV or AIDS, and also one is a chronic medical condition that is normally treated with a medication that can lead to dependence. So right now in Missouri, CBD is currently legal. That stands for cannabidiol. It's legal for the sole purpose of treating intractable epilepsy. And so CBD is a product that is defined as consisting of at least 5% of the cannabidiol and less than 0.3% of THC, which is that chemical that leads to the high that we all recognize marijuana is producing. The legislation that is currently in Missouri, it allows for 2 licensed nonprofit growers to exist, and both of those growers are currently out of St. Louis. But as you might have noticed, other businesses in Missouri sell CBD, including within North Kansas City. So back to our initiatives on the ballot next month. So the first one is Amendment 2. It's the Medical Marijuana and Veteran Healthcare Services Initiative, also known as New Approach Missouri. And then there's Amendment 3, which is the Medical Marijuana and Biomedical Research Drug Development Institute Initiative, known as Find the Cures. And then Proposition C, the Medical Marijuana and Veterans Healthcare Services Education, Drug Treatment, and Public Safety Initiative, known as Missourians for Patient Care Act. So currently, if both constitutional amendments, so Amendment 2 and Amendment 3, if they both pass at the polls, the petition that has the highest number of yes votes is the amendment that will be enacted. So if Amendment 2 gets 100 yes votes and Amendment 3 gets 101, regardless of how many no votes were there, they're only going to count the yes votes. And then if Proposition C passes alongside either one or both amendments, it is currently unclear as which would take effect because they operate in different ways. If Amendment 2 or Amendment 3 do pass, the Missouri Constitution will be amended to allow the use of medical marijuana under state law, but then do keep in mind that an amendment to the Missouri Constitution, it will not change the federal law, which means that marijuana possession, sale, and cultivation would still be a federal offense. And then similarly for Proposition C, although it does work differently because it's a statute instead of an amendment, the Missouri State Legislature could still, they could repeal or amend that proposition that was passed by voters. But even if it is passed by the legislature as well, it would still remain a federal offense. Amendment 2, or New Approach Missouri, it carries a 4% tax, which would be to benefit the health and care services for military veterans by the Missouri Veterans Commission. It's estimated to generate an estimated $18 million for state operating costs and veterans programs, and then $6 million for local governments every year. And it would be estimated to have operating costs of about $7 million. It would become effective December 6th of this year if it does pass, and it would be administered by the Department of Health and Senior Services. And then applications would become available and accepted for facilities and patients between June and August of next year. With Amendment 2, cultivation facilities cannot be limited to less than 100,000 Missouri, one per 100,000 Missouri residents. This means that there would be at least 60 cultivation facilities that would be allowable across the state. There would not be less than 24 dispensaries, facility licenses per U.S. congressional district. This amendment, it also allows for qualifying patients to grow up to 6 flowering plants for their own use. And then it also states that licenses cannot be granted to facilities that wish to locate within 1,000 feet of an elementary school, a child daycare center, or a church. And then we have Amendment 3, which is Find the Cures. It carries a 15% tax on the sales of marijuana, and it would be used to establish and fund a state research institute to conduct research with the purpose of developing cures and treatments for cancer. It's estimated to generate an annual about $66 million in taxes and fees, and then it would implementation costs would range from $186,000 in the first year and then increase to $500,000 annually. It would become effective December 31st of this year, administered by the Biomedical Research and Drug Development Institute and Board, which would be a new entity that would be created. Applications would become available and accepted for facilities and patients, most likely at the latest between June and August of 2019. With this amendment, Clay County, it could have up to 22 dispensaries, which equals 2 dispensaries per 20,000 residents. And with this amendment, it allows that local governments can submit written requests to exclude a municipality from the legislation for a period of 5 years, and then that could be renewable every 5 years after that if it's taken and approved by the citizens to be excluded again.
Is that first vote by the citizens as well?
No, it was the city council that would do the
Council
first
decision.
one.
Okay.
Yeah. So then we move to Proposition C, which is known as the Missourians for Patient Care Act. It carries a 2% tax that would be split equally 4 ways between veteran services, drug treatment facilities, childhood education, and it would for public safety departments where in cities that have a medical marijuana facility. It's estimated to actually save the state an approximate $11 million a year, and then costs could be estimated as high as $700,000 annually. And the legislation, it does acknowledge that local law enforcement costs could increase.
Isn't that true for all 3 of them?
This is the only one that included costs within the legislation, cost of that it could increase for local law enforcement. Prop C, it would become effective on March 6th of 2019, with applications being administered and made available and accepted it would be administered by the Division of Alcohol and Tobacco Control, and then the applications would be available and accepted for the facilities and the patients alike between September and November of next year. For Prop C, it includes the fact that local licensing authorities, and if they want to include specific standards, they must pass an ordinance. So for example, local governments, they could limit the use of land for medical cannabis facilities. You could limit them to specified areas within the town or to specific zoning locations. For this one, licenses granted, they cannot be limited to less than 1 license per 100,000 Missouri residents, and they state specifically that they would be spread geographically to ensure equal access for all patients in the state. And so this would amount to at least 60 cultivation facilities across the state. And then Prop C also includes that licenses cannot be granted to areas that are within 1,000 feet of schools or youth centers or daycare centers. So here we kind of see all 3 stacked up against each other. So at the top we have Amendment 2, 3, and Proposition C. It shows that Amendment 2 and 3, those are constitutional amendments, and then Proposition C is a statutory. It shows you the sponsors and the sales tax, and then who gets the revenue from the sales tax, and then that estimated state and local revenue, as well as the estimated state operating costs. And so then while talking about, this work session tonight, we really were concerned about what is the security that's included in each piece of legislation, both to secure the product and the income, as well as protecting the people that are going to the facilities. So on the left, you can see an example of a growing facility security. So as you can see, they have many different cameras, on-site security, somebody watching those cameras at all times. And then on the left, we have an example of a dispensary facility security. So he is there on-site during operating hours to ensure that the location is secure. Amendment 2, or new approach, within this legislation, it indicates that there is going to be something called a seed to sale tracking system, which would track the plant's entire life. So from the time it is planted to the time that it is sent off to be made into whatever product they decide to turn it into, it will be tracked. And then it also includes that any premise that's licensed under the legislation, it must have minimum security measures, which they see as lighting, physical security, videos, alarms, and then anything else that's deemed necessary by the Department of Health and Senior Services. Amendment 3, or Find the Cures, it lists that marijuana must be grown indoors in an enclosed lock facility, which they consider to be a room or a warehouse or a greenhouse. And then it must be equipped with locks and then only accessible by authorized personnel. And then Proposition C, or Missourians for Patient Care, the facilities would also have a cannabis plant monitoring system to track the plant from seed to sale, as well as allowing for a secure testing and data collection operation as deemed necessary to make sure that the plant is only used for medicinal use. And then any premise license under this legislation must have the minimum security measures of lights and physical security, videos, alarms, as deemed necessary by the Division of Alcohol and Tobacco Control. And then we all know that crime is going to be a concern. So I looked at a bunch of different studies and locations where medical marijuana specifically is currently legal and in effect. One study found that medical marijuana facilities are not predictive of higher crime and actually contributed to lower crime in areas where the facilities are located. The Denver Police Department found that dispensaries were robbed or burglarized at a lower rate than banks or liquor stores, but the study did not include information about robberies outside of the dispensaries, so in the areas where the dispensaries were located. Another study found that violent crime actually fell 13% when medical marijuana was legalized. This was particularly due to a decrease in demand for cartel source marijuana. And then a different study found that property crime in areas around dispensaries rose to similar levels of crime around bars, liquor stores, and restaurants that served alcohol. Alcohol-related businesses still led to more violent crime, though, than medical marijuana facilities. And so if at least one piece of legislation passes in November, there's going to be some questions that need to be answered. With Amendment 2, local governments, they can enact ordinances or they cannot enact ordinances that make it unduly burdensome for medical marijuana facilities within the jurisdiction, but they can enact ordinances or regulations that would govern the time, the place, and the manner of medical marijuana facilities within their jurisdiction. Amendment 3, or Find the Cures, it states that there can be 2 dispensaries for every 20,000 residents in a county, which means that there could be up to 22 dispensaries in Clay County. And so we would want to see, is the city interested in asking for an initial 5-year exclusion from any parts of the legislation? And then that would be reconsidered for a 5-year renewal if the public votes for it. And it makes it so that the city could say, no, we do not allow dispensaries within our city limits, but we do allow manufacturing facilities and cultivation. So it is a mix and match that you could create ordinances for. And then Proposition C, or Missourians for Patient Care, we would want to ask, does North Kansas City want to adopt an ordinance that contains specific standards beyond the minimum requirements as put forth in the legislation? So for example, do you wish to limit the use of land for operation of medical marijuana facilities? This ordinance It could include distance restrictions or requirements as deemed necessary to ensure the control of the premises or the ease of enforcement. And then also it includes the ability that if the legislation does pass, is North Kansas City interested in holding a public vote, which is passable with a 2/3 majority to prohibit the operation of medical marijuana facilities in North Kansas City. And so here they are all together again, showing you what kind of questions we should be asking right now. So with Amendment 2, local bans are not allowed, but local governments can regulate the location of facilities and dispensaries and the time and manner of their operation. Amendment 3, governments can prohibit the facilities and dispensaries at first for that 5-year period and then renew through a simple majority of votes for any of the 3 different dispensaries, manufacturing or growing. And then Proposition C, local government, you can prohibit the facilities and the dispensaries through a 2/3 vote of voters. And then this is a map of North Kansas City. The yellow squares, those are either schools or churches or daycares, and that shows you that 1,000-foot buffer zone. So it kind of illustrates for you where in the city Amendment 2 and Prop C would allow for facilities to exist. And then, any questions?
What's that on 15th?
Yeah, that's what I was wondering.
What's that one down there?
Like 15th and Burlington?
15th at Burlington?
Church is a church.
There's a church that's operating out of iWorks.
iWorks.
Yep. Same
Did
thing.
you have any studies, Megan, in regard to what Colorado in general was experiencing with legalized marijuana or other states that are having it in total or in portion?
There are some studies that I have. I could gather them and send them
Anything that you
along.
could share in general about?
In they're really what it seems to be there, but not be creating as much as of a ruckus as maybe thought of at first, especially in terms with when you compare it to like bars and stuff that sell alcohol.
I've always had a kind of a distrust of studies.
Sure.
You know, there's a predisposition to go in the direction that the studier wanted to. That's not always true, and I shouldn't generalize that, but I don't know about studies.
Chief Beamer, what are your thoughts on this?
We enforce the law. If the law changes, we adapt. And I mean, that's the bottom line here really, is if the voters in this state choose to go to medical marijuana, then we will work to determine what the new laws are going to be, what the requirements are in terms of whether it's dispensaries here in the city, manufacturing facilities. One of the questions that obviously we have is the security measures that are going to be in place on each type of facility. And we won't really know what those measures are until either the Department of Health or the State Liquor Control, Tobacco and Liquor Control Division, or the people working under the Bradshaw Amendment, Amendment 3, develop those. I know that there's some efforts taking place to try to have input on what some of those regulations may be as they are drafted to present to the various state units that are going to be managing this. But the bottom line is if the law changes, and there's been laws that have changed in the past, and we've adapted to those, and we'll adapt to this.
What control do they have over those that grow their own marijuana plants? How do we control that?
So it does mention, so this is Amendment 2. It mentions that anybody with a prescription can have 6 of their own flowering plants. And I think that I'm not for sure that, I do know that if you have a license for yourself and you have a license for somebody who is a minor or in your care, you can have then 12. But I do not know if they have any
Controlling
inspections
that.
or anything.
I wouldn't think that would even be possible.
That's going to be a challenge.
Yeah, that's going to be a challenge.
That's the piece of this and if I may, we've had a conversation with someone that represented the cannabis industry, and the cannabis industry is very interested in the manufacturing facilities, the labs, the manufacturing, the grow labs, and the dispensaries that are going to be operated by the industry. So they're very much focused on the regulations related to those three components. The home grow piece is not necessarily on their radar screen because that's not part of their industry. So it's going to be interesting to see how the state drafts regulations, statutes, whatever, to have home grow. And once again, only one of these three provisions allows for home grow. So Amendment 2 is the only one that could potentially have that piece with it.
I know a number of people, I guess, drove from Colorado into Kansas and into Missouri with loads of marijuana after this came into fruition. But you know,
And that was
being said,
probably recreational, though.
Right,
I mean, the
yeah.
quantities would indicate.
That being said, you know, the Volstead Act was one of the worst disasters that ever hit the United States of America. And it's an inevitable thing that we're going to have to adjust to the nuances and things of the day. I personally have little, if any, problem with medical marijuana. If someone's in pain, if they're on a dying course, and I don't have much problem with that, but the intricacies of managing it and controlling it, beyond my view, I don't know what to say about it.
I see, well, statement first, I see Missouri's trying to make it as confusing as possible, like they always do.
Amen.
You know, on propositions and amendments, there's going to be 99% of the people show up to polls not knowing the differences between these, and that's nothing to do with us, but it's a shame that they do it that way. And also, you know, I often wonder, how does the conflict get resolved between the states and federal governments? I know, you know, Arizona and Colorado, for sure, I got friends there that have they had to move from Missouri because of the pain they were in, and they's addicted to opiates, you know. But how does that work with the feds? Could come in and just arrest somebody if they wanted to, and they just don't do it? Or
The short answer is yes. There's been some action at the federal level to try to limit the U.S. attorneys from interceding in states where medical marijuana or recreational marijuana is legal. But the federal law still exists that makes marijuana a Schedule I controlled substance. There's continuing issues with the banking industry about wanting to interact with the cannabis industry because of this Schedule I classification. There is not, to my knowledge, been any active prosecution at the federal level in states where medical marijuana or recreational marijuana is legal by the feds. But until the law changes, or if the law changes, there is this divergence between the two.
okay, thank you.
On that first, the one with the veterans, if that passes, it's just for veterans or military people, or?
Let me pull it back up.
First one is for veterans only,
Yeah, I think the money just goes to them.
That's where the money goes.
Correct.
yeah. Not them.
The benefit of the sales tax goes towards health and care services for military veterans.
So I guess that's kind of like saying, you know, when the casino taxes going for education.
Correct.
We'll see how that worked out.
How does Northtown, oh, I'm sorry, go ahead, Councilman.
I just, couple of things. First of all, you know, like the chief said, this may change and we have to adapt to it. You know, we're always looking for repurposing of our warehouse district and things of that nature. I do agree with Bill that it needs to be heavily looked at and regulated, but you know, I think the only one that has the opt-out for the city is Amendment 3 or the 2/3 on Prop C. Is that correct?
Yes.
Okay.
With Amendment 2, you would be able to still
Regulate land
govern,
use and,
yes,
right.
yep.
Yes, sir.
Just one quick comment, just with one thing we've heard just recently, is that with regard to cultivation, and there might be, we do know that there are some people interested in doing business in North Kansas City if this becomes law. We've heard that odor can actually be an issue with large growing facilities. So that'd just be something to keep in mind if and when cultivation is proposed here in the city.
Even indoor? Even indoor? Okay.
I think so, yeah. So we've been told.
Does the same thing go with manufacturing? Indoor manufacturing? I
No.
imagine they could control that
Yeah,
odor
so
there.
we're told that labs and dispensaries, that's not
Are
an
not
issue. It's
odorous.
just the growing, yeah.
Well, I think this is going to come eventually. One of these amendments are probably going to pass. I think it's something the city should strongly consider. I think that the tax revenue would be an enormous boon. I'm just going on record as being in favor of medical marijuana and finding a way that we can make that happen to our tax advantage and to, frankly, our citizens' advantage in the state and our tax advantage as a city. I really appreciate you putting this together in such a concise way. It takes very difficult issues, and literally I now have them on one page, so I appreciate your work and effort that went into this. I also agree with you, Richard, that a lot of people won't understand this at all. So I guess our job as council members is to educate our constituents in regard to these before it comes on the ballot.
Tom?
I agree with Rita. I'm for it too. I think as a city, though, we should be proactive to the point to where when one of these pass, if not all of them, that we have as many of our ducks in a row as we can, so we can be on the cutting edge. If somebody comes to us, we're going to say, we're ready for you. Come on, let's go.
And that's the purpose of tonight's work session, largely to begin that process. And if something passes, then we were told, we did have a meeting with somebody from the industry just last week, and they indicated that to do if this passes, then probably at about a year's time from the election would be about the time that a business would begin being ready to operate. They indicated to us that their preference would be that localities have their whatever regulations that they might choose to put in place by, say, March of 2019. So our goal would be to try to work towards that if something passes.
Sounds great to me.
Yeah, me too.
Do we have anybody in the audience that is knowledgeable about this or planning to grow it or do anything?
What about on the dais?
That one guy got up.
Yes, my name is Randall Crawford. I'm an attorney on North Oak, 5950 North Oak. And the gentleman to my left, I don't know his name, but I believe you met with Jack Mitchell. Is that correct? Yes. Yeah, and Jack and I are working together on this in our office. And we have another attorney that's coming in as well to work with the cannabis industry. So we are, I'm not totally knowledgeable about it. There's a lot of words in both of these, all three of these initiatives. But I've heard back from Mr. Mitchell after the meeting with you, and we seemed encouraged that North Kansas City was, to follow what you said, is on board with this and wants to see it happen.
I don't
and I think
speak for the whole city.
Yeah, I understand that, but there seemed to be, some support anyway within North Kansas City. And getting, our goal as representing licensees, that's what we intend to do, or applicants for licensees, is that the cities are going to need to have their ordinances in place in order for this business to get operational. And so that's some concern to us in representing licensees, that we know what the state's saying, but yet we don't know what the zoning is going to be in Kansas City, North Kansas City, Liberty, or wherever in this area. So if all of that could be in place, then that helps us in locating buildings where we can do this at and would be very helpful to us. to know that, okay, here's a location that will work for dispensary, or here's a location that will work for a grow facility. And I think the only grow facilities you're going to have in North Kansas City is going to be indoor. I don't know possibly where you're going to do an outdoor grow facility. I've been to went to Phoenix here recently and saw an indoor grow facility. That's all they were. In fact, they had the indoor grow facility, they had the lab in one location, and had a dispensary in another location. I could not have identified what a marijuana plant was prior to going to there, and I didn't realize what a bud looked like. But and I've been told all these stories about odor, and I think there is probably some concern about that. I had there was zero odor outside this building at all. You wouldn't have known, totally nondescript, no name on the building or nothing for security reasons. And even inside, there was an odor, but I was expecting this powerful odor that would just knock me down. It wasn't there. And I've heard stories about people that their clothes reeked of it, and I didn't have any of that either. So I don't think odor, if it's handled properly, that is a problem at all, at least from what I observed at that one facility, because there was zero odor outside.
Thank you.
You're welcome.
Just to clarify one thing, staff is neither supportive nor non-supportive. We just want to be ready to deal with whatever comes.
Deal with what comes up.
Well, with that being said, is staff looking at ordinances in other cities that have been, who obviously have medical marijuana? And if so, is it possible if one of these amendments or Prop C passes, that you can supply us with the information pertinent to that particular amendment or proposition?
We have no, ma'am. We haven't looked at any specific ordinances, largely because every state's different.
Right.
And to some degree, as Chief Beamer indicated, we'll need to wait for some state guidance. But we are starting to think about some of the things that we might propose to you. And if you have any input for us tonight, we'd love to hear it in terms of any, zoning, security, whether there should be a buffer, say 1,000-foot buffer, things like that. If you told us you had a particular interest in that, that would help us. Otherwise, we'll begin taking a look. But of course, nobody here in Missouri yet has an ordinance because it's not legal yet.
Well, I was referring to other states.
No, but the one thing that we have been trying to do some research into what others do. Ms. Nakahoto and I, when we were at the ICMA conference last week, attended a session on cannabis to try to learn what some of the experience is from other cities. But we haven't dug really deep into specific ordinances in other states. But we are beginning to think about the kinds of things that we would need to bring to you, depending upon what state guidance is provided.
This is going to require a lot of thought, a lot of work sessions, and hopefully maybe some public input into the situation also. Without thinking it through, I would maybe consider seeing a vote of the people of North Kansas City as to what they wanted to do about it after we've come up with some definite thoughts of our own.
Well, if it's passed and it becomes state law, then I don't know what would.
Well,
I don't know what we'd put to a vote of the people. Most of these are going to be fairly, zoning type things. We're not going to get. I don't think we would be proposing.
I mean, even for having it.
Well, I don't know that the city could refuse to do it if it was passed statewide.
I thought Prop C had an opt-out.
Oh, well, we would. I'm sorry, you're right. We would bring you that if that one passes and that becomes law.
That's what I was referring to.
I apologize. You're right.
No problem.
Then we would ask you if you wanted to go for a 5-year opt-out or not. If you told us you wanted to put it on the ballot, we could do that.
Well, these are all options that we need to consider as we.
Well, it's going to be dependent on which one passes. Amendment 2, Amendment 3, Prop C, all has different pieces. I mean, under Amendment 2, it's going to be unduly burdening, so not really going to make any difference to the city. But under the other two, there are some options. So
if they all pass, then looks like it, or if the amendments pass, then it takes the highest vote of the yes vote on the amendments. Is that correct?
Yes, it is.
Right, and then Prop C, we don't know. So okay.
I just said, what was some of the positive and negative feedback from the session you attended?
Yeah.
Is there?
And Kim, if you want to jump in, you can. What I think the overall thing that we heard, and a lot of the folks who were there are from states that have recreational marijuana already. Although we did talked to some folks in Michigan. To answer your question, you did ask about specific ordinances. Actually, I apologize. Kim did get some information from Michigan, from a city in Michigan that currently has medical marijuana and has recreational marijuana on the ballot, but they currently are medical marijuana. So we did get some information from them, and we might use that as a basis for bringing something to you. I guess what I heard as much as anything was that a lot of them were very worried about the repercussions prior to these marijuana laws coming into effect in their states, and they found that the problems weren't as great as they had feared. Did you have any particular impression?
That's exactly what we heard, that they spent a lot of time worrying and were very concerned about all of the elements. Was this going to increase crime? What was this going to do to property values? A lot of dialogue about those short and long-term ramifications within the community, and a lot of the city managers and assistants share that didn't come to fruition. I did grab several ordinances from Michigan. Michigan has had medical marijuana for several years, so they have seen it go through those bumps at the state level, and it is now a smoother operating system. So we kind of have at least something that if it were to be approved by Missouri, obviously there need to be modifications to make it personalized to our city and our state, but we do have at least one or two good examples.
Good. Thank you.
I didn't notice that the cost, the cost on some of them was way up there and the other cost was way down there. I mean.
Are you referring to the tax rate? Per.
Yeah,
So yeah, it's determined by the specific groups that created the legislation.
Amendment 2 estimated operating cost was $7 million. And the other one was 500,000 or something like that.
And that was just according to their estimates based, within the office.
But the revenues are also increased on each of those.
Correct, because Amendment 3 has a 15% tax, while the others are 2 and 4. So that's going to reflect.
15% tax, do you know how much that goes local? Or is that
None. It all goes towards, for Amendment 3, it all goes towards the research.
So I think, is that similar in all three of them? Is that there is no additional local?
Correct.
Tax? Okay. So the tax that we could collect, can we collect any tax on it?
Nothing further than, I believe, because it is a prescription, it is only a tax on the sales that goes towards.
So like our current tax rate would, like our current sales tax rate would apply?
I am not positive. I think because it's a prescription.
All right, thank you.
Yeah, that's a good question.
Okay.
Wait, I've been trying to get my.
We would need to see some state guidance if local sales tax could even be applied to this. I hate to say it.
We're not entirely sure right now.
Yeah.
It's vague, but we are unclear. Multiple other states are allowed to apply local sales tax or to have a special tax. We would really need to have some direction from the state.
Yeah, I just think that's something to put on the question list. I just wanted to say that I agree with a lot of what the council has said. The one thing I'm probably the most nervous about is dispensaries, and just wanting to understand on the dispensaries if there's any increase in street crime, either, because as people are going in, it's an all-cash business, and so they generally, I think, have ATMs in the facilities, but people could have cash on them. They leave the facilities and, they have probably product on them. And so that makes them good targets for street crime, both entering and exiting. So I don't know if you've looked into that at all, but that's probably the one concern I have.
Yeah, Chief Beamer, do you have any concerns that you'd just like to bring to the council's attention?
That's a concern of mine as well, is not necessarily, crime at a dispensary is lower. Well, yeah, you've got lots of security there, armed security there, because it is a cash operation. I've contacted Denver. I tried to I figured they'd be as good a source, and I had a contact in the Denver Police Department that I reached out to. I never heard back. I tried to get the information, but that is, to your point, I'm concerned much more about dispensaries than I am about a grow operation or a manufacturing operation, just because the cash, the location, the foot traffic in and out of it. And I'm going to continue to try and gather that information. Before the meeting tonight, I was unable to obtain it.
Yeah, okay. Well, we have time to do that, but that's probably the piece that concerns me the most. I've seen medical marijuana work for people. I've seen people close to death who were able to have some medical marijuana and actually save their lives. And so I've seen it work and understand it and have sort of changed my views and been more open to it now than I probably have been in my past. And I've seen it in Arizona work, and I've seen it in Colorado, and it's not really, the world didn't implode in Colorado, so that's recreational and medical. So anyway, I'm in support, and as long as we can get the details worked out.
Rick?
Yeah, one does it have to be a cash operation?
Because of the banking.
Because of federal laws,
Yeah.
banking.
Banks won't take the money.
banking
Because of the
laws.
because it is against, marijuana is against federal law, and so banking is regulated federally.
Yeah, it's regulated by the Federal Reserve, so you can't send the money, whether it's through the bank draft or through, it's just cash, cash only.
We have heard that there has been some workarounds in terms of, for example, using banks that aren't FDIC insured, things
Right.
like that.
Yes.
That's not anything we have a whole lot of knowledge about, but that's part of the reason that a lot of it is a cash business, is
Yes,
because
there
of
are
the
money-
difficulty in banking.
There are money transactions that do not go through the Federal Reserve that could be used for this, but I think a lot of times they're complicated, and so people just make it a cash operation and put an ATM in their lobby or whatever.
Bitcoins.
Bitcoin,
Long-term, it's going to take a Supreme Court case, in my opinion,
To overturn.
to turn this into either
Yeah.
marijuana is legal in the country or not legal, but that's on down the road. Otherwise, state by state, it's going to be a nightmare.
Well, here we go.
Okay,
Move it forward.
we good?
There's nothing else. That's I said, our main purpose was informational tonight, and if something passes, we'll be coming back to you for further guidance.
Thank you.
Move to adjourn.
Second.
All in favor?
Aye.